Hi guys. Good morning to everyone present here. Uh, I have with me Dr. Vishal, who has secured 166 All India rank in NEET SS 2022. So this is an amazing feat, and I'm happy to know that he's interested and is pursuing to take medical gastroenterology as his choice of subject. So, way to Dr. Vishal. Hi, Dr. Vishal. How are you?
Hello, sir. I'm doing great, sir.
Nice, Vishal. So it's a very good rank that you have got. So it's like the entire gates are open for you. So you have a wide panorama of subjects that you can take. So first, before jumping into a lot of other questions, I don't want to get deviated. I would just want to ask about yourself, like where did you do your UG, PG, and what made you focus towards gastroenterology and things like that. Could you just introduce about yourself?
Yes, sir. My name is Vishal, and so I am from Ahmedabad. So I did my undergraduates from GCS Medical College, Ahmedabad, and then I did my PG, post graduation from NHL Medical College, Ahmedabad. And sir, in our institute, they had a residency program of gastromedicine. So, sir, we had a rotation in the gastromedicine department. And during my first year, and like the rotation is in second year, but during the first and the third year, we are constantly in contact with the residents of the gastromedicine department. So, talking to them and seeing how they manage the patients, seeing them doing the procedures, I was very interested in that. And when I attended the rotation at that time, I realized that this is something which I would like to do as my future branch. So from that time, I was inclined towards gastro, and like yeah, yes.
Really nice. So the good thing is you did your UG and PG at your home city,
Yes, sir.
Ahmedabad, and then now you have gotten a seat also immediately. Now, when did you pass out your MD? Like, is it recent or?
Yes, sir. So I cleared my MD in May this year itself, in May
Okay.
2022.
Okay, you have completed in May, and here in September, October time, you already have a rank with you. So you hardly like had some 4 months for preparation, I guess, isn't it? Or maybe 2 months because the exam got over quite
Yes,
some
sir.
time ago.
Yes, sir.
So were you preparing for NEET SS even during your PG days, or everything started after your exams and you got your results?
Yes, sir. From the last day itself, there was a news that it might happen that the pattern will change into a completely medicine pattern. So while preparing for my MD exams, and I prepared from Harrison, and I focused on areas which could be a potential MCQ part or something like that. And as I said, that I had some inclination towards gastro, so I paid special attention to gastro. So one of my senior, he is in PGI Chandigarh gastro, so I used to talk to him, and he used to guide me what to read and where to read from. And so after MD, like there was a stay in the court, and it was not decided where it will go. So at that time, I kept on revising my medicine notes, and then once it was finalized, I like focused solely on the medicine part, my Harrison notes and other stuff which I collected from the other tests and everything. So
Great, great. So that's really nice to know that you had an inclination towards the subject and you were clear on what subject you were taking. That's phenomenal. That would reduce a lot of doubts and your preparation strategies also.
yes,
Second, you had a mentor from different directions and some role models that you came across during your MD days to,
yes,
further put your energy towards a single focused subject. That's very nice. And coming to your preparation strategy of starting well in advance during your MD time itself, knowing that the preparation, the strategy that you may require is little different from usual, that you need to know entire medicine to some extent really plays a major role. So
yes.
everything went hands in hand, and now here you are with an amazing rank. So congratulations once again. So
Thank you very much, sir.
yeah. So the next question that I would want to ask you is, you told that you had read Harrison fully and you had made your notes. So
Yes.
how did that, lead on to, solving MCQs, and to what extent Harrison was helpful for you to solve questions? There were definitely around, I guess, 15% of questions to 20% which were outside Harrison's. Now,
Yes.
what helped you answer those questions? Little light on the percentage of questions from which book?
Yes, I would say that so majority of the questions, apart from the genetics part and apart from the congenital syndromes part, it was basic medicine only. And so like few of them were image-based questions, and few of them like there was a case scenario, but in the end they were asking one liner itself. Like they had given a sentence in the end, and they were asking the questions from that only. So, sir, those questions I guess I was able to solve from Harrison itself. And sir, the congenital syndromes and the genetics part, like I had not prepared specifically for that. Sir, like a few of the concepts like I could recall from the UG days, and few things like we read about some syndromes, and like there's a doubt that what was there in autosomal recessive or X-linked pattern, and just we look on the Google or anything. So it was purely that. Like I had not prepared specially for genetics or congenital syndromes from any source. And sir, while revising the like my Harrison notes, it was not possible to revise each and everything. So at that time, sir, the MCQs and the Qbanks and the test series which I had subscribed from DocTutorials, they played a role that I was able to mark out which topics to focus on, and from which part the questions are coming frequently, and from which part the questions had been asked previously. So I could revise them again and again when next time I took that subject.
Okay, so DocTutorials question bank really helped you get through the overall aspect of all the different fields and types of questions.
Yes, sir. So both the Qbank and the test series, grand test was excellent, sir.
Okay, so grand test, what was your approximate rank? Were you like you were able to gauge your progress through that?
Yeah, sir. Sir, in like initially when I started solving the grand test, so I used to stand around. So my rank used to be around 100 out of 400 or 500 students. And so gradually in a span of 4 months, I progressed from like I used to get a rank around between 20 to 50 in the end. And so my percentile used to be around 98, 99%. So I was sure that if everything goes well, then I would be able to score at least these percentile I could score in the main exam. So I like me and my friend we used to talk that like if at all we get within 200, then it would be all right. So sir, we worked it that way.
Yes, good. So you were able to predict from your GT
Yes,
that
yes,
I will be landing up with a good rank.
yes, sir.
If of course, if most of the things go on well as we are called, that's really nice to know. So, what is your suggestion for the next generation of students, your juniors, to be on the preparation level? Like some of them will be in MD first year. There are some of my students who call me from MD days, first year, second year itself, and trying, sir, what to do, kaisa karna hai, kya karna hai, tell me how to be focused. NESS, now this, the entire pattern is here. I'm get too tense. So, what do you tell your juniors? Like, when is the best time to probably subscribe to GTs or at least subscribe to some video sessions so that your concept starts building up? Like, what do you suggest the best time to start off?
Yes, sir. I would suggest the best time to start off with the videos is during the third year of residency, when you get time to study. At that time, like as I said, that Harrison is a huge book, and no one can possibly remember each and every line from the textbook.
Absolutely.
So if we watch videos, we get a clear concept, and we get to know that which part to focus on for the MCQ part as such. Because to gain the knowledge and to gain the concepts, everything is important. But for the uh, exam point of view, they give you the pointers and the part from which MCQs was again and again. So we can do the video series from the final year, and I would suggest to solve the grand test after you complete your MD. And in the 4 month period, you can give grand test every 15 days or every 7 days, and then you can judge where you are going.
Okay, nice.
Yes, sir.
Okay. Now we came up with this QRP sessions. So was that relevant for this particular exam? We had many specialists come and take their part on important things. I had done the gastro and the hepatology in 2 different sessions, and we had a lot of our colleagues and faculties who took classes. So how helpful was the QRP sessions?
The QRP sessions were very helpful, and so like in the revise such a huge course, and at that time QRP came, and so we were able to revise many things by just looking at 1 or 2 slides itself. Like if we used to see 40 or 50 slides, almost half of the subject used to get covered. So it was very helpful that way. And so many one-liners, and like in ID, in endo, and in gastro also, many things which were mentioned in QRP came as such in the form of MCQs. So QRP was very helpful, and so specifically in this exam pattern in which you have the whole course, and you can't differentiate yourself what to read and what to not. In that scenario, it comes into play because you have you give 3 days to a subject and you have to prepare the subject in 3 days. So it gives you a path that you can do at least this, if not everything.
Yeah, that's the point, because Harrison is a huge book. It has
Yes, sir.
so much information put in that. So to demystify and try to get it, and one lifetime may not be enough to complete it whole and
Yes,
whole
sir.
and understand everything. So you
Yes.
might have to divide it into different subjects. So that way, these kind of programs definitely help you to at least have a feel that yes, I have done something and everything, and probably whatever question comes, I would be able to solve with some of my preparation plus some luck and some other things.
Yes, it gives you confidence that at least you are done with the subject now. Like if everything goes well, it will be in your favor. So
absolutely, absolutely. Very nice and well elucidated, Dr. Vishal. Really take home points were there, like when to start off during your MD days for preparation, and how QRP sessions helped you, how the GTs helped to assess to gauge what kind of rank you may get in the main arena. So that's great. So just the last question I would want to ask you is, for NESS, the methodology is different. Already, did you start preparing from Schlesinger for your next NESS just in case, or were you totally focused on NEET SS, and that is what has really helped you right now, that you were not too distracted with a lot of bigger books?
So I tried, sir. Like as I said, one of my senior, he's in PJ Chandigarh.
Yes.
So he had made few of his notes from Schlesinger. So I started reading in it when I was preparing for the NEET. But then I realized that it is not possible to it is not feasible to give so much time to one subject, and so because other subjects will get compromised. So, sir, till in the 4 months after May, so I would suggest that go just with what you have read for MD. Like, don't fall in trap. I will go for this and that. Don't go for anything fancy. Whatever you have read in medicine and whatever you have seen in your patient, that is going to help definitely. Because if an ABGA is asked and if you have seen that, if you have solved that in your patient, then it's definitely going to help you in the MCQ as well. So.
A great, Dr. Vishal. Point well taken. All in beautiful points you have told what students should be following. Really proud of you. So next we will have a session on the different gastro colleges and what could happen and how to choose a seat of your choice in a preferable college and or hospital of your choice. Soon we'll catch up in that session, which will happen in due course. Congratulations once again from DocTutorials team.
Thank you so much, sir. Thank you, sir. Yes.